Morgan. Dr. Morgan, always so good to see you. Now, statistics show that during this specific type of medical emergency, about half of patients will actually even make it to the hospital, and then only about half of that number will actually survive. So what is this exactly? Why is an aortic dissection so deadly?
Yeah, great to see you too, Nicole. This is one of the true cardiac emergencies when we talk about aortic dissection. The aorta, which is the big artery that actually comes directly out of the heart and feeds blood and oxygen to the rest of the body, including the brain, is really the most critical organ there in the body. And it is comprised of three layers. And that inner layer if it tears, you end up with blood in between that layer, and then it obstructs, it blocks the artery, and that can cause that dissection. It begins to rip and it begins to tear. It is one of the true emergencies in cardiology.
Yeah, and one would have to imagine that would be extremely painful. What is the treatment, doctor, and then who is most at risk?
So it is painful. The treatment, depending on the type of tear, type A tears, or different types of tears, do require surgery, and surgery really needs to be at a very experienced medical center for the most optimal outcomes. The risk factors really include a combination of a weakening of the artery, so it becomes more fragile, loss of collagen, loss of elastin, so it becomes weaker, combined with things like hypertension, where you've got shear stress in that artery and an artery that's already weakened. But also things like a family history. I understand his father died suddenly at 69. There could be family history, and an aneurysm, meaning there is a bulging and a swelling because that artery, that aortic wall has already become weaker and it is swelling. So those are probably the top three risk factors.
All right. Last question for you, doctor. What does prevention look like, especially if this can strike people who look and feel just fine? I mean, Senator Graham certainly looked healthy.
And that's part of the challenge oftentimes in cardiology. Hypertension, that's why it's known as the silent killer. It can cause so much damage in the body, and you really don't feel it until the moment you're having a catastrophic event, including a heart attack, a stroke, and in this case, an aortic dissection. If that aorta completely ruptures, then it really is catastrophic. There you have minutes really to seek emergency care. And so often, taking care of just basic risk factors, making certain your blood pressure is controlled, you have a family history of early cardiac deaths, you need to do a little bit more workup and investigation and be transparent about that with your physician.
All right. Dr. Jane Morgan, thank you as always.
Thanks, Nicole.